Good morning. This is George LeMieux from the Gunster Law Firm. We're here on our first video cast with a very good friend of mine, a great leader in our community, in our state, in our country, Dr. Wael Barusoum, who is the CEO and president of Cleveland Clinic in the Florida region. Under his leadership, U.S. News and World Report has ranked Cleveland Clinic first in Miami-Fort Lauderdale metro region as the top hospital for 2019 through 2020. Dr. Barusoum is not only a great leader in public health, but he's also a tremendous physician, researcher, inventor, and an all-around great leader and great guy. So it's my privilege to welcome my friend, Dr. Wael Barusoum, to our first video cast here at the Gunster Firm.
Senator, thank you so much for that kind introduction. It's a pleasure to be with you.
Well, it's great to be with you. What an extraordinary time, Will, that we're living through. Here we are amidst a pandemic, something that we really haven't seen anything like in the last 100 years. The big question right from the beginning that everybody has is here we are at the end of April. We've been dealing with this since at least the beginning of March, if not February, and we hear the expression flattening the curve. Have we flattened the curve?
Yeah, that's a great question, and I'm happy to tell you that there's really no doubt that we have. If you look at the number of new cases that we get each day, if you get the numbers on the number of deaths that we see each day and the number of hospitalizations, the increases have been going down very steadily. And one of the keys for us to really look at carefully is to have about 14 days of a consistent decrease in new cases, and I'm happy to say that we're seeing that right now.
So what does the future look like for us? I know you've been asked by the governor to be on his Restart Advisory Board. We're going to, at some point, get back to, operating our businesses in a new normal way. What do you think the next 2, 4, 6 weeks look like for us here in Florida?
So, it's interesting as we've kind of coming to the end of this first phase of trying to contain the virus, which is really the key, that flattening the curve phase, and coming into the second phase of being logical, thoughtful, with a slow reopening in lower risk areas. The key then really becomes testing, identification of positive patients, and quarantine. So where I think we will likely go here within the next few weeks is a slow reopening of the economy with a significant enhancement to our laboratory ability and our testing and screening ability so that we can go after folks that are showing symptoms, get them tested right away, and then have them quarantined. So a lot of moving parts to making that happen well, but I'm happy to say that there are a lot of really smart folks working on this.
Dr. Barusoum, Cleveland Clinic has been a leader in testing. Can you tell us how that testing is going to work and how we're going to make it available in a sufficient way to be able to get people back to work?
Sure, happy to. So we were the first site for drive-through testing in Broward County, in St. Lucie County, in Martin County, and in Indian River County, and we were the second site in Palm Beach County with a lot of help from the state, the county, and the National Guard. Without a doubt, having that infrastructure for really two things. Number one, collecting the samples, which is important. Right now we're using drive-through testing, we're testing in the hospitals, we're testing in emergency departments. Eventually we will likely start seeing more and more of a shift into at-home testing where you get a kit, you swab yourself, you send the kit in, and the lab tests it. So the first part is the specimen collection. The second part is building the capacity in terms of our laboratories. So there you're going to see a combination of hospitals, private laboratories, the state, all coming together to have a network of sites where all of these samples that we're collecting can in fact be run on the laboratories, and then be able to contact the patients that are positive, do contact tracing, meaning anybody that they've come in contact with, trace their contacts to ensure that we're really kind of stamping out the virus. We call that virus hunting, where you're not waiting for it to come to you, you're actually going to it to try to find those folks, quarantine them, and limit the spread as we're reopening the economy.
So let's talk about how that's going to work. Here at the Gunster Law Firm, we're all shut down. I'm the only person here today in the office. We have more than 200 people working remotely. Say we start to partially open. Are we going to be, do you think, businesses like us and businesses board, are we going to be checking people's temperature when they come in the door? Certainly we're going to tell them stay home if they don't feel well. Are we asking them if they don't feel well to test? And, will they get a quick turnaround on that self-test? I mean, sort of the atmospherics of what this is going to feel like as we start to open.
Yeah. Senator, the world is definitely going to change here for a while. There's no doubt about that. I think we really need to be thoughtful about continuing the social distancing protocols that we've had. In other words, when you're having your board meetings, for example, your executive team meetings, you're going to want to maintain that 6 feet, in between one another. We won't be sitting right next to each other anymore, avoiding things like shaking hands and, greeting each other with friendly hugs. Those things we want to maintain that social distancing. I also think that we're going to see a lot more people wearing masks a lot more often. Keep in mind that the cloth masks that more of us are wearing today are really meant for cough etiquette. They're meant for you to prevent your cough from infecting somebody else. They're not really protecting you from somebody else coughing on you. So that's important to recognize that the cloth masks are great to protect the world from you. They're not doing a lot to protect you other than maybe helping you to not touch your face often or touch your nose, touch your mouth, which of course is important. Frequent hand washing will certainly continue to play a role. And then when it comes to bringing people back into work, I think what we're going to end up seeing is some prioritization of who we test. So in other words, if you work in a nursing home taking care of a highly vulnerable population, you're going to need likely to have at least your temperature checked or some type of formalized testing to ensure that you're safe and not bringing something into that vulnerable population. I think at a high level, temperature checking is a good move. But the one thing that I just want to be clear about that people really have to take seriously is any symptoms at all of an upper respiratory tract infection, sneezing, coughing, sore throat, or any GI infections like diarrhea, vomiting. You need to get tested. You need to not go to the office. You need to self-quarantine, and you need to get tested. If we don't each take that personal social responsibility, we are going to see a significant second surge. So we really have to take that seriously, and candidly, we have to hold one another accountable to that. I think that's going to be a key.
Well, I think that's fantastic advice, and you said it in such a clear way. Let me finish with this, because we've all been so impressed, and our feelings go out towards all the caregivers, your doctors, your nurses, your staff, and all of the folks who've been doing that across our state and across our country. Tell us what you're doing to keep your staff safe and how you're keeping their spirits up. And, they've got families too. They have to come home. They've been in a high-risk environment. I know this has been a real focus for the Cleveland Clinic, so I'd like you to finish with that is, how are you taking care of the people who are taking care of us?
Yeah, Senator, I will tell you, I have never in my life seen such an incredible kind of esprit de corps amongst healthcare providers. It is stressful. I round in the COVID units several times a week, but people are upbeat. People are proud of the fact that they're saving lives. So it's very much a two-way street. What caregivers are giving to us, to our society, is amazing. What we've done for our caregivers is several things. Number one, we committed early on to no layoffs, to not docking people's paycheck, to not taking people's vacation time. And I think that has been a real great feel for our caregivers, knowing that the Cleveland Clinic is fully behind them through this. We've also made arrangements with several hotels throughout Southeast Florida, where if we have a caregiver that does test positive, they can stay in that hotel. We cover the cost of that. It protects their family members. And in addition, anybody who might live with an older family member, for example, parents or grandparents, we've made that same housing available to them so that they're not putting a highly vulnerable group at risk. We have relaxation stations in all of our hospitals. So If you are a frontline caregiver and you need to take a little break, we have kind of machines for getting a massage so that we're maintaining the social distancing, but at the same time allowing people to kind of take a little bit of a break. A 24-hour hotline that is staffed by occupational health nurses help answer any questions. Now, one of the things that I am very happy about is as we've been testing our caregivers, and at this point we've probably tested about 7% of our caregivers, so it's a fairly high number. Anybody that has any symptoms or just wants to be tested, we will test. We're finding that our incidence of COVID-19 is about the same as it is in the community. So it tells us that the protections that we have put in place following CDC guidelines and World Health Organizational guidelines are in fact keeping our caregivers safe. And our number one priority is maintaining the safety of our caregivers and our patients as we deal with this and learn from it every day.
Well, we're so thankful for that, and the Cleveland Clinic is such an important part of our community. These caregivers are really angels for us, so thank you for that. Thank you for your leadership. Thank you for being our inaugural guest on our View from the Top videocast here at the Gunster Law Firm. Wish you well, and I hope we have the opportunity to catch back up with you, in the weeks and months ahead, because this is going to be developing. I'm sure our progress is not going to be linear. We're going to have, achievements, and then we're going to have setbacks. But we're all in this together, and we're really grateful for you, Dr. Barusoum.
Thank you so much, Senator. It's a pleasure. Thank you.